Hi, this is Dr. Robert Dowse from Pediatrics, and today I want to talk a little bit about some of the potential infections that we can get that are common things that, if left untreated, can become potentially disastrous things. In the medical field, we have lots of germs that are becoming more resistant. We have lots of illnesses that are being detected and new viruses and new bugs all the time. And so, of course, that's one of the things that we worry about. But something common like strep throat, think about strep throat. One of those things that we diagnose almost every day or every week in my clinic. And it's something that, if left undetected and untreated, can potentially lead to other very disastrous things. For example, you've heard of perhaps of rheumatic fever. Rheumatic fever is strep throat basically that has spread because of not being treated into various parts of the body, such as the heart. And it can cause, rheumatic heart disease can cause valves in the heart to become deformed. And it can become a very chronic or acute disease that can be lifelong problematic. And so it's one of those things that we don't like to see strep being untreated. Untreated strep can lead to kidney disease. It's called glomerulonephritis or post-streptococcal glomerulonephritis. And that can cause permanent or temporary damage to the kidneys. And that's a very awful thing as well. Another thing that can happen from untreated strep can be scarlet fever. You've heard of scarlet fever. Scarlet fever is just basically, it's a scarlet type rash that is secondary to the same germ that causes strep throat. And that can also lead to kidney disease and heart disease. So these are a lot of good reasons just for strep throat. So if your child has a sore throat accompanied by headache, a fever, and stomach ache, which is typically the presentation for strep, not usually with a cough or congestion, but just the sore throat, fever, headache, abdominal pain, that's probably strep, or at least needs to be ruled out. So bring your clinic to your doctor. That's very important. I was thinking about another option as well. Ear infections, very, very common. And in fact, most of your children probably had one or two ear infections throughout their lives. But if ear infections are not treated on time, then they become very chronic. And when you think about the bones inside the middle ear, the bones in the ear are what help produce sound. There's three basic bones, and they're little tiny things that fit together. And when you get an ear infection, a middle ear infection, the pus that surrounds those bones just sits there, and it can start to degrade and demineralize those bones. And then those bones can become weakened permanently. So children that have chronic ear infections that are left untreated also can have hearing problems permanently for life. So those are just a couple examples of common things that we see that a lot of times we think, oh, we don't need to go to the doctor for that. But again, there is some risk to not being seen and not having it treated properly. And if it's not treated, it can lead to some permanent disease. Again, I'm Dr. Dowse from Pediatrics. If you have any other questions, please check our Facebook page. Thanks. Bye-bye.